It's happening now. Flu season is in full swing. According to the CDC, South Carolina among the states with the highest level of flu activity. Upstate doctors say they're seeing a lot of patients right now. And joining us today is Dr. Aaron Collins. He's a ER physician with Bon Secours. Good afternoon, doctor. Thanks for being with us this afternoon.
My pleasure. Thank you for having me.
So you're specifically in the ER, and you told me before we got to this segment that you've been seeing a lot of people coming in with these flu-like symptoms, to the ER. It's something that I wouldn't think of going to the emergency room typically with.
That's true. We do. We have been seeing a lot of more patients coming in, people with runny noses, fevers, coughing, sort of your prototypical flu symptoms where they get really short of breath. And a lot of the patients that come to us may not necessarily need the ER, but sometimes they don't have anywhere else to go.
Sure.
And since we're open 24/7, they'll come see us, and usually we can at least offer them some help.
Yeah. Are you seeing that influx of patients maybe compared to last year, this year, this time of year in December?
Yeah, very much so. It definitely seems like the flu season is starting a lot earlier than it has in the past. Normally, the flu season doesn't really peak until February, sometimes late January. This year, though, it seems like it's maybe not at its peak, but certainly getting there a lot sooner than we would expect it to. And I don't know if that's just because the flu is a bit more virulent this year. I don't know if it's people are moving around more, but it definitely seems to be hitting us a lot earlier than usual.
And we've been stressing the flu shot,
Absolutely,
from what?
absolutely.
A few months ago. People can still get it. It's still available.
Correct, and it is not too late by any means. Going ahead and getting your flu shot now can definitely help protect you coming through January, February, into March even, because flu season can sometimes last that long. So even if you haven't gotten your flu shot yet, it is definitely not too late to get one.
I'm one of those people.
You should definitely get it.
Don't be mad at me.
Oh, but it's good for you. You definitely need to get one.
I've got to do it. You're just so busy sometimes, but it takes what? Just a few minutes?
Not even that long. It's a few seconds.
Okay,
yep.
Perfect.
Definitely worth getting.
I will do that. Now, who is the most at risk, maybe age group, people to see those flu complications, maybe?
There's a lot of patients that we would consider medically fragile. For example, patients who have sickle cell disease, patients who have cystic fibrosis, older patients, patients maybe with some severe lung disease from COPD or emphysema, people who are on immunotherapies. That whole category of individuals is at much higher risk for complications from the flu, simply because either through medications or their illnesses, their lungs are more fragile, they can't fight off the illness as well, they can't adapt, their lungs don't work as well. So those patients definitely need to come to the ER to see us. Most other patients who are somewhat medically normal probably can go to an urgent care, their primary care doctor. They don't necessarily have to come to the ER, although we'd be glad to help them. But certainly if you're at any sort of high risk, any sort of complicated medical problem, definitely need to come into the ER to see us.
Okay. And one final thing, wash your hands.
Absolutely. Hygiene.
How do you prevent it? Wash your hands and use Lysol or
cough
hand
in your
sanitizer.
Elbow. Be courteous. Absolutely.
Yes. Awesome. Thank you for those tips. It's always good to stay up to date on the latest with the flu going around. Thank you, Dr. Collins.
You're welcome.